Hi everyone, my name is Christina Kahala and I will be discussing tricyclic antidepressants and the nervous system today. The nervous system is a network of specific cells that control how we recognize, understand, and react to our bodies and what's around us. It is separated into the brain and spinal cord and also nerves that control voluntary and involuntary movements. Some disorders of the nervous system include vascular and bleeding disorders, degenerative or congenital problems, and also mental health problems such as anxiety, psychosis, and depression, which I will be talking about. So what is depression? Depression is a very common mood disorder. It includes feeling of sadness, loss of interest. Symptoms are little energy, sleep problems, feelings of worthlessness. Sometimes patients have angry outbursts, changes in appetite, limited libido, and also frequent thoughts of death and suicide. There are several types of depression. Major depression, which is characterized by intense sadness or lost in usual activities. This can occur once in a lifetime. Persistent depressive disorder is less severe, but it lasts 2 years. And psychotic depression, which is when a person has depression plus a form of psychosis. Also, there's postpartum depression that occurs after childbirth, and that results from hormone and physical changes. And lastly, seasonal affective disorder that's related to changes in the season, usually during winter months. So the pathophysiology of depression, there is a theory called biogenic amine hypothesis theory, and it suggests that depression is resulted from a deficiency of biogenic amines in the brain. These biogenic amines include norepinephrine, dopamine, or serotonin. Antidepressants increase the synaptic concentration in the brain when taken. And also a lack of these neurotransmitters develop due from monoamine oxidase, breaking them down to be recycled. It could also be from the rapid firing of neurons leading to their depletion, and the increase in postsynaptic receptors leading to depletion of neurotransmitter levels. Also, depression may occur from causes that are still unknown. It could affect the reticular activating system, the limbic system, and the basal ganglia. Medications used to treat depression. There are different ways that this is done by medication. One way is inhibiting the effects of MAO, leading to the increase in norepinephrine and serotonin, which is NE and then 5-HT. They also block the reuptake by releasing the nerve, leading to an increase in neurotransmitter levels. And also they regulate the receptor sites and breakdown, resulting in greater levels of neurotransmitters. There are 3 groups of antidepressants: tricyclic antidepressants, monoamine oxidase inhibitors, and selective serotonin reuptake inhibitors. But I will be talking about tricyclic antidepressants specifically, and they are in the therapeutic drug class of antidepressants. So tricyclic antidepressants include amines, secondary amines, and tetracyclines. They work by reducing the reuptake of 5-HT and NE into the nerves. Some examples of tricyclic antidepressants include Elavil, anafranil, ludiumil, and sermontil. But the most common is Elavil that is used. Tricyclic antidepressants, as I said, stop the reuptake of the neurotransmitters serotonin and norepinephrine, and then this results in an increase in synaptic cleft and an increase in stimulation of the postsynaptic receptors. It is indicated to treat symptoms of depression, also indicated for enuresis, agoraphobia, which is fear of open spaces with panic attacks, can be used for chronic pain, and also for migraine headaches. TCAs, tricyclic antidepressants, have sedative and anticholinergic effects. They are well absorbed into the GI tract and reach peak levels in 2 to 4 hours. They also have a long half-life, 8 to 46 hours. It is metabolized in children rapidly and more slowly in the elderly. Contraindications for TCAs. They have a high risk of hypersensitivity reactions, so it is important to assess for any allergies for any of the drugs in this class. Also caution for patients who have pre-existing cardiovascular disorders. Any recent myocardial infarction is contraindicated because it could reoccur again, and also it could extend the infarct. Also, a myelogram within 24 hours or 48 hours after the medication is contraindicated because of the interactions with the dye. Any concurrent use with MAOIs, they have serious toxic effects. There is a black box warning for risk of suicide in the children and adolescents, and also caution in patients with seizures because it could increase the seizure threshold. Some side effects of TCAs include sedation, which Elavil has the most severe sedating effect. Also sleep disturbances, fatigue, hallucinations, visual disturbances, difficulty concentrating, weakness, ataxia, tremors. Gastrointestinal anticholinergic effects can include dry mouth, nausea, vomiting, urinary retention, and then changes in libido, as I stated. Cardiovascular effects, orthostatic hypotension, angina, and stroke. Any sudden stop in TCAs can cause a withdrawal syndrome, which is characterized by nausea, headache, vertigo, malaise, and nightmares. So cultural considerations and herbal therapy interactions. St. John's wort can have possible interactions with tricyclic antidepressants. Specific ones that interact include Elavil, Pamelor, and Tofranil. So it is very important that patients tell their healthcare provider about any herbal or alternative therapy uses. Also, cultural considerations. Nurses need to be culturally competent and respect the patient's value. A lot of cultures reject the idea and use of antidepressants. So nursing strategies and interventions. It is important for nurses to assess for any allergies to avoid hypersensitivity reactions or any history of seizures, as I stated earlier, for side effects. Nurses also must assess baseline status before administering medication. This includes temperature, weight, skin color, orientation, blood pressure, respirations, and bowel sounds. Some nursing diagnoses that can be included are acute pain related to anticholinergic effects of the medications or disturbed thought processes related to the CNS effects. Nursing implementations include limiting the drug access to suicidal patients because for the risk of overdose. Also, it is important to continue drug therapy for 4 to 8 weeks to assess the effects of the medication. Administering TCAs at bedtime can also reduce the risk of injury because of the side effect of drowsiness. Providing calming measures to help the patient endure the side effects. This could include taking medication with food to decrease GI effects or also voiding before administration. And also, it is vital for the nurse to provide teaching to the patient about medication to improve the patient's knowledge of the drug. Evaluation of the medication includes observing the patient's reaction to the drug, monitoring side effects, evaluating how much the patient has been educated, how much they know, and also see if they're compliant with the medication. Lastly, research literature, as stated by Lovat in the article tricyclic's pharmacological profile, that there are special populations to consider when giving this drug class. Elderly. The elderly have higher drug concentrations. They have a slow clearance with age. So it is very important that they are monitored and observed, and maybe dosage are adjusted. Patients with renal and hepatic impairments must have caution when taking this medication. It is advised to avoid this class with patients who have severe hepatic impairments. And lastly, patients who are pregnant or breastfeeding, also recommended to avoid use because it can pass into the breast milk, and it is also associated with developmental problems. And this is the list of references. So next I will be talking about my handout, the patient education handout. So tricyclic antidepressants are in the pharmacologic drug class. Tricyclic antidepressants, therapeutic drug class antidepressant. As I stated in the PowerPoint, some examples of the drugs are Elavil, Norepinephrine, Vivistil, and Sermontil. Therapeutic action, it inhibits presynaptic reuptake of neurotransmitter serotonin, norepinephrine, indicated for the relief of symptoms for depression. Contraindications with hypersensitivity reactions, so it is important to assess for any allergies. Myelogram, important to assess for that. Also contraindicated with MAOIs because of the possibility for toxic reactions, and pregnancy and breastfeeding could have adverse effects in the fetus and the neonate. Side effects include sedation, fatigue, visual disturbances, difficulty concentrating, weakness, dry mouth, vomiting, cramps, urinary retention, loss of libido, hypertension, angina, MIs, alopecia, weight loss or weight gain, nasal congestion, and also abrupt cessation could cause withdrawal syndrome, indicated by nausea, headache, vertigo, malaise, and nightmares. Drug-to-drug interactions include medications, cimetidine, fluoxetine, and ranitidine. These could increase TCA levels. Combining TCAs with oral anticoagulants may also lead to high serum levels and increased risk of bleeding. It is important if you are taking these together to get your blood checked regularly. TCAs combined with sympathomimetics or clonidine can also increase the risk for arrhythmias and hypertension. TCAs with MAOIs can lead to antipyretic crisis, and that results in severe convulsions, hypertension, and even leads to death. St. John's wort interacts with TCAs, as I stated earlier. Routes of administration and dosing, as shown here. The medication, and then the dosage, and then the route, PO, so by mouth. And then follow-up indications, maintain your initial dose, don't stop abruptly, takes 4 to 8 weeks, monitor for any side effects, adverse effects, and report them. Report any use of herbal medications or alternative therapy with your healthcare provider. And then this is my reference. Thank you very much. Okay, Joy, how do I stop it now?